Should I start? Good evening, everyone, and greeting from Advanced Cell Group, and welcome to our webinar series. So I'm Dr. Lippi, Technical Director and the Vice President for the Advanced Cell Group. Today, we have invited Dr. Prashant from special webinar on platelet-rich plasma or PRP in regenerative dentistry for dental care. Dr. Prashant himself is a dentist and holding a degree for regenerative medicine from Manipal University. He has a great clinical experience of PRP in periodontal defects and chronic wounds. He's also a clinical fellow in medical cosmetics and laser dentistry. Taking not such time, I would request Dr. Prashant to please enlighten us with the PRP in dental care. And we'll take up the question at the end of the talk, and also would request the audience for your feedback for our webinar. So please, Dr. Prashant, please go ahead. Thank you very much.
Yeah, shall I start the seminar?
बोला कुल मिला के 16 लोग
जैसे हम भी हैं
भेजो भेजो किसको नोट पे इधर मैं फोटो लेता हूँ
I'll start in 2 minutes.
Sure, please.
Hello.
Yes, Dr. Prashant, please.
Shall I start the seminar?
Yes, sure. All are here.
Yeah. My name is Dr. Prashant. I have done my BDS from Mamta Dental College, Khammam. Interest towards the research made me to pursue the degree in stem cells and regenerative medicine in Manipal. Today, I want to explain the role of PRP in regenerative dentistry. As we know, the PRP therapy is gaining its popularity as a single supportive treatment option for many indications. As we know, the PRP contains different growth factors, cytokines that stimulates the healing of bone and soft tissue. If you take 10 ml of blood, approximately it contains 55% of the plasma. Can hello? Can you hear me?
Yes, we can. Go ahead, please.
Okay. So there are different growth factors in PRP that stimulates their cellular growth and division. So there are different growth factors that are present in PRP, includes transforming growth factors, beta, basic fibroblastic growth factors, platelets derived growth factors, epidermal growth factors, vascular endothelial growth factor, and connective tissue growth factor. So why we choose a PRP therapy for the treatment option? Because it is a very safest method and it is a very convenient method. It is a natural method and it is very effective in terms of treatment. So we want to know how we will prepare the PRP. Usually we'll take around 10 to 15 ml of blood sample was aspirated and placed in a sterile test tube. We'll add anticoagulant sodium citrate as an anticoagulant, and we will centrifuge at 10 minutes at 4000 rpm. Subsequently, we will get the yellow color plasma. On the topmost layer, we will get the yellow color plasma that contains buffy coat with platelets and leukocytes. That was taken by using, we can use a syringe or micropipette. So The application of PRP we are using in different conditions in medicine. We can use in orthopedics, we can use in maxillofacial surgeries, we can use in plastic surgeries, cardiac surgery, cosmetic surgery, we can use in general surgery. Now they are using widely in sport medicine, we can use in during hair transplant, we can use in skin regeneration and dentistry. If you comes in specific to the orthopedics and sport injuries, we can use this PRP in knee degenerative arthritis. We can use in thumb degenerative arthritis. We can use in sport ligament tears and many conditions. When it comes to the role of PRP in dermatology and plastic surgery, we are using exclusively in the field of aesthetics. We can use the PRP for androgenic alopecia. It requires 3 to 5 sittings. Can you hear me? Hello.
Yes, we can hear you.
Yeah. So we can use PRP in hair transplant for the better healing, and it acts as an anti-inflammatory. So we can also use the PRP for decreasing the stretch marks by using PRP with microneedling. We can also decrease the skin pores and also increases the elasticity of the skin. We can also treat skin pigmented disorders with PRP. As we know, with the aging, the skin sags with the lack of collagen. So when we inject the PRP into the face, it stimulates the endogenous cells that stimulate the collagen production and helps as an anti-aging. We can also use a PRP in the laser procedures. We can also include the PRP along with the skin grafts. We can use the PRP in the craniofacial surgeries. First, I want to explain the mechanism of wound and how the PRP can applied in the wounds. So normally we know there are different stages of wound includes hemostasis, inflammation, proliferation, and maturation. If there is a delay in inflammation and proliferation, that leads to the chronic wound. As we know, the key players in the chronic wounds that includes keratinocytes, fibroblasts, and neutrophils. In the chronic wounds, what happens means there will be the decrease in the angiogenesis because of the bacterial infection. There will be the heightened inflammation. So when we inject the PRP at the site of the wound, that increases the angiogenesis and it acts as an anti-inflammatory. So we can use PRP in various conditions of wounds like infected wounds, neuropathic ulcers. We can use in wound stitch marks. We can use in severe burns. We can use in non-healing wounds. We can use in diabetic foot ulcers. We can use in cellulitis cases. Here comes the role of PRP in the regenerative dentistry. We can use PRP in various conditions of dental, like we can use this PRP along PRP for the dental implants for the better bone regeneration. We can use this PRP in onlay and inlay grafts. We can use this in sinus lift procedure for the bone healing. We can also use this PRF plugs in the post extraction. So today my topic of interest is to treat the chronic periodontal diseases with the PRP. As we know, in the normal tooth, we have the healthy gums and the bone is healthy, and then there is no inflammation. In the chronic wound, there will be the inflammation will be more. There we can see the bone loss, and there is a decrease in the blood circulation because of the bacterial infection. The clinical features of chronic periodontal disease includes, it mostly occurs in adults but can also occur in children. The supragingival and subgingival plaque accumulation can be seen. Gingiva is inflamed. We can see the pocket formation. There is a loss of periodontal attachment. In the chronic periodontal diseases, we can see the poor oral hygiene because the gingiva is swollen. As we know, there are different treatment options for treating the chronic periodontal diseases. Traditional methods options includes we can treat with lasers, we can treat with normal scaling, and we can add the bone graft. In spite of having these treatment options, there is a lacune, there is a gap for treating the chronic periodontal diseases. So here comes the role of PRP that promotes as a pro-angiogenic, means increases the blood circulation, and it acts as an anti-inflammatory in a chronic periodontal cases. So first we will do with the scaling to remove the bacterial infection around the tooth, and we can also use lasers for decreasing the bacteria. When we combine the PRP with the traditional treatments, we can see the better results. So this is one of my case I want to share with you. So there is a we can see how the gingiva is become better. So by using the PRP from the patient's own blood, so we can say the success is in the patient's own blood. Uh, yeah, done. Anyone has any doubts?
Hello.
Yeah, tell me.
So you have done with that?
Yeah. You can ask any questions. The participants can ask any questions.
Wait.
So
can you stop your sharing? I want to share my PPT.
yeah, I will do.
Hello. Yeah, so you have seen some of the slides that Dr. Prashant showed that we can use in regenerative dentistry, the PRP as a adjunct therapy. So as you know that it is safe, effective, and natural and convenient. Also, a regulation point of view, US FDA approved, not coming under the as usual that we need to do any clinical trial. So it's okay to go ahead with the clinical therapy. And you can see the normal platelet plasma composition. And I mine is focused on our advanced cell PRP system, what exactly it is. We are providing with the kit. That kit is contained the PRP, advanced cells, PRP concentrator. This is the concentrator. And with the 5 ml syringes, with 20 ml syringes to withdraw the blood, and 2 different kind of needle as well, and the butterfly needles with the anticoagulants. They all come into our PRP kit. So this 20 ml blood, using this, we will first pick out the ACD as an anticoagulant, and then we use this needle to put the blood into this concentrator. You see here the PRP concentrator here. So put the blood here, and run as usual into centrifuge for 10 minutes. And we have done the validation as well on this PRP kit, and very good results. We have seen here the platelets is more than 80% viable and integrate. I mean, there is no premature activation or viability also maintained. And the less granulocytes is very important. That is less granulocytes as compared to the manual method, and high WBC count, and also few cells of CD34 cells too. So it's helpful for, we have done on the hair regrowth, so very good results with the using of this kit. And we are using the acid citrate dextrose solution. Why? As an anticoagulant is a gold standard, but the mechanism is that because this is giving the, maintaining the pH is 7.2, also maintain the morphology of the platelet and the viability all intact. So for this, is it a standard gold method as an anticoagulant ACT we are using in this kit, and also the dextrose in this, which maintain the platelet metabolism and also the viability. While the citrate we have used here, it binds the calcium to prevent the premature coagulation. So the whole is said this kit is far better than the manual method. And you can see the all growth factors is higher as compared to the normal manual method. So as Dr. Prashant already told in different growth factors, so here different role of each growth factors. Suppose in case of platelet-derived factor, this is percentage is very high, is good for chemoattractive for the stem cell or endothelial cells present in that region. Also the transforming growth factor, which brings the differentiation or mitosis, and the vascular growth factor brings angiogenesis, that is the blood circulations. As compared to the normal method, this our PRP advanced cell PRP system has, when you do this way, the PRP contain more mononuclear cells as compared to granulocytes. So it's good for the clinical use. And also I told you that this is CD4 positive cells, few cells, not I'm saying high amount, but few cells also present in this system. So it's good for the hair regeneration. We have done the study on that. So this is the comparison method. This is manual method. Generally, people do this, and it is open method. So you are using micropipette and taking, and there is no clear cut WBC demarcation you can see. But while using our system, you can see first is the blood here, 20 ml, and centrifuge. We can see this spot is pure Buffy coat. And this, when there is a handle in the kit to screw up down. So screw up and you can get this here in this neck. And here this is totally demarcated, the poor fraction and the rich fraction of platelet. So you can take out with the big needle, it is provided in the kit, and go for therapy straight away. So it looks very handy and an all closed system. And very all sterile, and we follow the US FDA compliant as well. So all closed system, no contamination, no all closed system. So, and having the all growth factors is higher amount as compared to the normal method, and also the WBC is higher in our this PRP way PRP system. So we have used this PRP kit in various indication and pain management, sports medicines, hair growth, wound healing, aesthetic also, and have a good result as well. So now we have opened the area in the dentistry for use in endodontics or surgery already mentioned by Dr. Prashant. So we are happy to provide this one if you're going to use for dentistry in a clinical practice. So if we're very good in whole, say in the good results as compared to the manual methods and other methods provided by the in the market. So any question or query, if you have, you can contact us through email or by direct call. This is here 965432140 or by info@vancell.com. And at this moment, you have any query, please let us know. We'll discuss. And the webinar is open for the discussion now.
I will open my slides. You can, yeah.
So I stopped sharing mine. You can open that.
Yeah. Anyone can ask the questions. Any queries? The main motto of the treating the chronic periodontal diseases with the PRP is to decrease the inflammation and increases the angiogenesis. And the PRP has many factors that helps in bone regeneration also. Someone
There's a
asked,
question on the chat.
yeah. Someone asked, what is the difference between the PRP and PRF? So when we add anticoagulant, we will get the PRP. When we don't add a anticoagulant, we will get the fibrin. So in terms of to get the better bone healing, we will use the fibrins. In sinus lift cases, post extraction, like that.
Oh my, stop my video. That's I cannot hear you.
Hello.
Yeah, somebody asked a question, Dr. Prashant.
Yeah.
When combined PRP, scaling and all, with the already you have talked about the conventional as well as additional PRP for better healing. I guess, yes.
Yeah.
Please, you can enlighten.
Yeah, so when we combine the traditional treatment with the PRP, so the traditional treatments like the scaling, with the scaling, the bacterial means whatever the accumulation plaque or bacterial infection, we will clean with the scaling. After that, when we will add the PRP, it acts as a better option, treatment option. Instead of going for the scaling, when we combine with the PRP, that plays the better role. Okay.
Does anybody have used before PRP? You can also
Yeah, yeah, we can use.
give there can
Yeah,
give us insight. Uh,
so, yeah, we can use PRP in endodontic surgeries. No, in the case of periapical abscess, we can remove the abscess and we can place the PRP or PRF membranes at the site of periapical abscess.
um, we have another question for you, Dr. Prashant. Can we say PRP is an integral component of jaw bone surgery?
No, it is an alternative therapy for the better bone regeneration. It will act as a means PRP has a BMP bone morphogenic factor that helps in uh, for the better bone regeneration.
So you mean to say that it's an alternative
Yeah,
therapy?
yeah.
We have 10 minutes. You have more questions for us?
In case of chronic periodontal diseases, we can treat the patient for the twice in the means the duration between the sitting to sitting means if you treat the patients today, if you are feeling the healing is not progressive and it is not up to the mark, you can do the second sitting also in very severe cases. Instead of going for the one sitting, you can do two sittings of PRP with the traditional treatments. Yeah. The same question, how many sittings of PRP is required for the chronic periodontal diseases? So it depends how severe it is. So approximately after 21 days, we can see the changes. What are the changes? We can see how the periodontal ligament means periodontium is becoming healthy and all. If you're seeing the inflammation is more, then you can add one more sitting of PRP. Is that the results are more better than lasers. So usually when we combine the PRP with the laser, it is giving best and best results. We can also combine the PRP lasers and biostimulation that gives a better results. So instead of going with only PRP, we can also combine with the lasers and we can also use photobiomodulation that will give the better results. So when we include other treatment options together, it is giving the best results. As per my clinical knowledge, when we combine with the lasers and PRP, it is working very good. You can see the best results. You can see results after 1 week only when we combine with the lasers. The main motto of PRP is to increase the blood circulation and decreases the inflammation.
So the discussion on that, we can say PRP can be recommended for dentistry as well, and also is giving the better results than usual conventional methods. And because the role of PRP here, to understand that you have to increase the blood circulation as well as decrease the inflammatory due to any means in. So it will give the better result with the conventional treatment. So for healing recovery better, faster. So I think it's recommended for using PRP in these cases, as discussed with Dr. Prashant here. So you have any more question? We have 5 minutes left. And last but not the least, also I would say that the PRP generally in practice, the manual methods go for closed system. It's more, you will be safer side and more effective in terms of you have to see when you process the blood and then you get the PRP, what's the percentage of these growth factor and the viability, platelet recovery, whether it is integral or not, viability and recovery. That is very important in case of you are using the PRP. So we recommend for the closed system, and US is FDA compliance as well, and is effective and safe as compared to manual methods. Price of the kit is not very high, so it's about 3,500 per kit, and it's very handy. There's nothing to worry for anything. Everything is there from with blood withdrawal up to the injection at the site. So it's very handy. I will recommend go for that and use and try. So thank you very much. No more questions. So we'll request for your feedback about the webinar. And if you more on this, we'll again, but your feedback is very important for us. So thank you very much joining us. See you next time. Bye-bye.
Bye-bye.